We're going to take the walk through the clinic now. We have the workroom here where the sterilization is done, and the patients come past this area into the operating rooms, and the convenience of just shuttling between the two operating rooms I really find efficient. Now we're entering the recovery area, the holding area preoperatively and the recovery area postoperatively. And Mrs. Decapite is here. You had your surgery a few minutes ago, and how is your vision by now? Is it better? Good. And did you have any pain? Oh. Good. So what we appreciate about this environment is to be able to have a family member with the patient until the point they go into the operating room, and even to come into the operating room with them, which we do encourage. We have just cover gowns over street clothes for the family members to come into the operating room with the patient if they choose to. And if not, they are welcome to go to the observation room, which we'll see in a few moments. But particularly waiting, and as soon as they come out of the operating room, the family member can be with them, which we find reduces anxiety a great deal. Well, I'm happy that your operation went well, and the vision should get better as the pupil gets small and you recover from all that light. Okay. Hello. What does she say about her vision? Wonderful. So, the vision better, color, better color?
Nhìn thấy có rõ màu không?
Rõ rồi, rõ lắm. Mà đồng hồ treo kia đỡ kia nhìn thấy rõ rồi. Ở nhà mọi không nhìn rõ, bây giờ làm cái mổ để nhìn rõ. Chúng tôi rất cảm ơn các bác sĩ.
That's wonderful. And I understand you're quite a walker. Now you won't stumble when you walk.
Yeah. Ông bảo là bây giờ mà không có đi bộ mà không có sợ thì.
Okay. You enjoy the vision and let us know if there are any problems. Okay.
Just have a seat over here.
I don't know how many of you are using topical anesthesia, but it's quite a special experience when some of these patients, particularly a person very highly myopic or hyperopic with bad cataracts, they come from the operating room and sometimes are overcome with emotion. And not only the surgeon gets to experience that and the family members immediately after surgery, but also the operating room personnel, who usually have not seen the result of the surgery because that's experienced the next day when the patch comes off. Now the operating room personnel get to see the immediate improvement in vision, and it's quite thrilling for them. So that's just a side benefit of topical anesthesia. Well, these folks are patiently waiting, and we'll get to you shortly. And we'll walk through to the observation room now. I have an examining room here where I can come in and examine patients preoperatively or postoperatively without changing my clothes, and I find that very convenient because sometimes you want to check the pressure just before or after, or there's emergency patients that I'm asked to see, and I can just slip in here and do that without going to the clinical area of the practice. Now we'll walk through the main waiting room. Some family members choose to wait here, and Veronica is here to greet the patients when they come in and to check all the information and to make sure the consent is formed. The consent sign is consent form is signed. And this is the door into the observation room, which is right behind the operating rooms. And you can see the view that the family members who choose to come here to watch the surgery, the view that they get of the operating room. We have floor to ceiling glass and wall to wall, so that it's just, we want to make it like they are really almost in the operating room and have that kind of experience. Then as well, we have the monitor where the family member can watch the procedure that with the microscope view. And Lil is here to explain the operation to the family member. And we have some instruments that she can show them, the size that we work with. And we have a microphone, a PZM microphone here, so that the patient can talk with the family member. We have a microphone in there, and two-way communication, and that will often also help to lower the anxiety of the family member and the patient when they can have that little short communication as the surgery is beginning. Then you see over in the counters over there our recording equipment to record in a patient tape, a tape for the referring doctor, a tape for our library, our master tape, which is what we edit from, and we record every case so that we don't lose any interesting case, any complicated case. They're all recorded and indexed as to which ones have some teaching value or something we need to refer to easily. But if it's a routine case, it's sort of named and filed, but not indexed as any special interest. And we record now on high 8, so we can get a number of cases on a little small 2-hour tape, and it doesn't take up much shelf space to store a few years of surgery. Okay, we'll go back into the operating room. And we'll stop and see Dr. Hamilton and the This is Dr. Hamilton.
Hello.
Meet the folks in Brazil.
Okay, hi.
He's the anesthetist here that makes sure the patients are comfortable during surgery, and we really appreciate that service, and I'm sure you do as well as patients. Mrs. Fowley?
Irene.
Irene?
Yep.
How are you today?
Fine, thank you. How are you?
Fine. Any questions last minute?
No, I don't think so.
Okay.
I'm interested.
Well, thank you for participating in this educational venture, too. The folks from Brazil really do appreciate it.